tips. What do you do when sudden injuries such as burns, cuts, and dislocation occur to you or someone close to you? How would you respond to bleeding and maybe a sudden injury to stabilize an injured person before transporting them to the hospital? Those are questions that I'm asking you today. With us in the studio today to give us all the juice on first aid to help save ourselves and other loved ones in an event of a domestic or injury, Dr. Joelle Amissah. She's a junior resident in general surgery at Korle Bu Teaching Hospital. Joelle, good morning. Welcome to the show.
Good morning. Thank you very much for having me.
What is first aid? Break it down for a 6-year-old who's watching us right now.
So first aid is anything that you do to help someone who you realize has come up with a sudden illness or a sudden injury at whatever place you find yourself at. So it could be at work, it could be on the street, it could be at home. So that's the main principle of first aid.
Okay.
And the point of that is to, one, preserve life, so to make sure that the person doesn't die. And then to make sure that whatever is happening doesn't get worse. So for example, if this person is bleeding, you want to stop the bleeding.
Yes. And
then to whatever you do, your intervention shouldn't cause more harm. And then you make sure that you help to speedy recovery. So that's what first aid is in a nutshell.
Okay, great stuff. What's the first thing you do when you want to give first aid?
So it depends on what is happening, but by way of principles, you'd want to take the person away from the offending agent, because you have to remember that first aid isn't just with injury, it's also with illness. So if you have someone with asthma, then ideally the person should have an inhaler. But if some people's asthma is triggered, so if it's for example a strong perfume, then you take the person away to a well ventilated place or something like that. Yes.
All right. Are you ready to demonstrate certain things for us?
Sure. Why not?
What are you going with first?
Okay. Seeing as a lot of injuries happen domestically, let's do burns.
Burns. Okay.
So, but I don't really have a demonstration, but I'd want to talk about what to do.
Okay. Assuming I got a burn on my hand, what would you do?
So the first thing I'd have to do is clean my own hands, and then put your hand under running water, clean running water at room temperature. What some people will do is they'll try and get ice water, but what that does is that it rather makes the burnt tissue become dead more quickly. So and then you have a bigger wound. Okay. Then some other people would want to put egg yolk and all those things. But
egg yolk?
Yes.
What are they trying to do?
So they are trying, I guess, to soothe the burning sensation and also stop the burn from spreading. But you see, the thing is, first of all, it's not sterile. It's not clean. So for all you know, the bacteria that's in the egg yolk would just end up getting into the burn wound, which would make it worse.
I've never heard of that. Egg yolk?
Oh, yes.
They put, what else? What kind of strange things?
There's been salt, there's been sugar, there's been flour. So,
flour?
Yeah.
What, are they making cookies or what? What's going on? Wow. Okay, so no egg yolk, no flour, no sugar.
No, just clean running water for about 15 to 20 minutes. One of my bosses would say, rinse till you get bored and then rinse some more. Okay. And then while doing that, you try to get a sterile again dressing. One of the principles of first aid is whatever you're using has to be clean and used for the first time. So if you don't have a sterile dressing, then what you do is use cling film, which is readily available in most, and then wrap it around.
So do you have a sterile dressing here?
Yes, I do.
Let's see what it looks like.
A lot. So this is one. We call these tonsils in the hospital. It's gauze that has been cut into long pieces.
Yes. You want to open it?
Sure.
Yeah, let's see what's inside. People are curious. So once again, when you get a burn, you want to pour just regular water over the burn.
At room temperature.
At room temperature. So maybe water from like the awake bottle.
Yes.
You just pour that on your burn.
So this is a tonsil.
Okay.
It's unlikely you'd get a tonsil commercially. You'd get the squares, the square gauze, but it's the same material.
Okay, then what would you do?
So, well, this wouldn't be for a burn, but this is also sterile dressing.
Okay.
So your normal first aid box would have sterile dressings of different sizes,
Okay.
depending on the size of the wound.
Okay.
You'd use a tonsil for a cut instead.
Okay. How would this work? How would you?
So, well...
Can I bring my hand over for you to demonstrate?
Sure, that's fine.
Okay. We'll scoot over. Okay, so I'll bring my chair. Okay.
So again, clean hands. But since I have gloves with me, and what I like to do is to prepare all my things beforehand.
Okay.
It makes everything quicker. So let's say you have...
I have a band on my hand.
You still want a bend?
Yes. All right.
So let's see. So we are done with bend, so let's do a cut. So
this is a cut?
Yes.
Okay.
Okay. So you have a cut.
So the box has standard stuff in it, right?
So the thing about first aid boxes is they are personalized. So depending on where you are and what you're using, so sort of contaminated might feel, but it's fine. Okay.
So this is for a cut?
Yes.
Okay. And this dressing is the...
This is just gauze.
Gauze.
So you gauge.
Okay, so you're cutting that?
Yeah. At least trying to. Luckily for me, I should have a blade.
Okay. Oh yeah, in the absence of a knife or scissors, you use a blade. Okay.
It's a surgical blade.
Surgical blade.
Yes. So ideally you should have a sharp scissors that cuts.
Okay. So we use that to cut the...
Yes.
Okay.
And then as you can see, it's fraying. So when I'm doing the dressing, I would tuck the frayed ends in so that they don't stay and become a focus of infection.
So I present my hand.
Okay. So let's see, this is here. And
that's the why you stripped the thing ahead of time. So when you put it on, then so that's it.
So,
done.
Yeah.
Double.
Just to cover all the glass.
Okay. And so the principle is that you're trying to prevent what from happening to my hand?
So first of all, I don't want any outside bacteria to get in. And the side that I don't want, if it's bleeding, I want to apply this as a pressure dressing so the bleeding would stop.
Okay.
Yes.
All right. What else can you demonstrate for us?
So let's say you get, what else normally happens? So in the case of children especially, a dislocation or a fracture.
Okay. Now what's a dislocation?
So dislocation is when any of your joints moves out of position.
Where are they going?
So what a joint is a bone in another space created by another bone. So sometimes by way of muscle pull usually, then they just get out. Mostly from impact from force or an accident or something like that.
So it gets out of joint?
Yes. Getting out of joint is a dislocation.
I see people try to push it back.
Yeah, that causes more harm.
Yeah, it's
actually
torture. So what do you do if there's a dislocation?
So if you have a dislocation, you would first of all give the person analgesia, painkillers, because it's very, very painful.
Do you have painkillers inside the box?
Yes, I do. So I have paracetamol here, and then I have aceclofenac, which is a bit stronger than paracetamol.
Okay.
Yes.
So you give them a painkiller first?
Yes.
All right.
And then I'd have to find a way to so that when the person gets to the hospital, that is when would give even stronger painkillers and then put it back in. So where do you want to
so this arm has been dislocated.
Okay. So what I do is, so this is a triangular bandage.
Bandage?
Yes.
Okay.
But you can also just use a scarf at home.
A regular duku?
Yes.
Okay.
And then you fold it into a triangle.
Okay.
So I would splint in a position of function. This is called a position of function because you can still use
I can
your
still use
hand.
this. Okay.
Yes. So then I'd put it close to your body, which gives the least amount of pain.
Okay.
Okay, then I'd put one end here, and then the other one here, and then tie it as close to your body as possible.
So this is a splint, right?
Yes, this is a splint. Anything that would immobilize you for a bit is a splint.
Okay.
And then we have this last thing here, which we normally just twist.
Just twist it.
Yeah.
Okay. And the idea is that it's supposed to prevent my hand from moving.
Yes, because the more it moves, the more it's going to cause pain.
Okay.
So if this doesn't stick, again, I'll
You can use your plaster.
just for you to get to the hospital. Then when you get to the hospital, like I said, you get stronger analgesia, and then it's just put back for you. Well, first you do an x-ray to find out in which direction.
Okay.
And then we would give you the analgesia, put it back in, do another x-ray, keep you in a better splint.
Okay.
So either a broad arm sling or a collar and cuff.
Okay.
And then take you back.
So this should keep my hand mobilized until we get to the hospital.
Yes.
Okay.
So
could you apply this principle if there was a leg? Can legs be dislocated?
yes.
Okay.
So in that case, you'd use a different kind of splint.
Okay.
So you'd use this.
Okay.
So let me free you from this.
You want to free me? I don't mind.
You don't mind?
Yeah.
Okay. It looks like you're getting too many injuries today.
Yeah, I'm enjoying it. Yeah. It's all for public education. All right. Okay, so we've done burns, we've done cuts, we've done dislocation. How about fainting?
Fainting. Okay. So when someone faints, what's happening is probably the brain is not getting enough oxygen. So the first thing to do would be to lay the person down on a flat surface. You clear the area around, make sure that there's nothing harmful. If you see the person fainting, then you try and catch the person, prevent the person from hitting his or her head. And when you lay the person down, you turn their head to one side. That is because when people are unconscious, the tongue can roll back. If the tongue rolls back, then they're not getting oxygen, so they end up just choking.
So they lie back, but their head on one side?
Yes.
Okay.
You just tilt the head to one side. So
All right.
if there's anything blocking, it'll just move to one. Yes. And then you raise the person's legs. You can use a chair or anything. So you have to raise it above the level of the heart. What you're trying to do is get the blood in the veins to flow back, and with that, oxygen flows back in the hope that it will get back to the person's brain.
Okay.
Yes.
Okay. Should I faint for you to show what to do?
No, that's fine.
No, I'll be conscious, but then you can just show me. It's all right.
It's all right.
I don't mind, but if you don't mind, no problem. So you do that, and then you raise the person's leg.
Yes. But you can use it on a chair, but you have to make sure it's above the level of the heart.
Okay. Why?
To make sure that so you are creating a gradient sort of.
Okay,
so
slope.
so that the blood would flow down.
Okay.
Get to the heart would pump it.
Okay.
It will get to the brain.
Okay.
And then hopefully this should revive the person.
Okay.
Yes.
All right. But I wish this. We have a mat there. I could actually go there. Then you show me how it's done. Yeah.
Okay.
Yeah. Let's go. So this is a fainting. All right. So I fainted, and then you show how we do it. So I should just faint, right? Okay. So
if you're trying.
I should go this way.
So we are assuming that
okay.
I didn't realize you were fainting.
Okay. So
then I'd have to catch you.
All right. Okay. So, but assuming that I'm on the ground now.
Okay.
Okay. So I'm gone.
You're gone.
Okay. Like this.
So then check for a pulse. At least you have a pulse. You're breathing. I'd move your head to one side.
Okay.
Then I'd get a chair or a stool. Put your legs up. Okay. And then this should revive you.
Okay, so this is like the gradient.
Yes.
So that it's higher than my heart.
Yes.
The idea is that what the heart should get more blood. Is that correct?
The idea is that if there's any blood pooled in your veins
Okay.
at your feet, it's going to move back and it's going to kickstart the circulation.
Okay.
So that you can have both blood and oxygen
Okay.
flowing through, and then it will get to your brain.
And this should normally do the trick, right?
Yes, this should normally do the trick.
Okay. What's CPR?
So CPR is the principle of cardiopulmonary resuscitation.
Okay.
So it has to do with the heart. Should I put your legs down?
Yes, you can put my legs down. All right.
Cardio has to do with the heart.
Okay.
And then pulmonary has to do with the lungs.
Okay.
So you're trying to kickstart the heart and the lungs to make sure that the person, to make sure you keep the person alive.
Is that
basically.
the pumping thing?
Yes.
Yeah. You want to demonstrate?
Sure.
Yes. I'm going back again. I fainted again.
You fainted again.
Okay.
Sure.
Faint again.
So for CPR, the first thing I'd have to do is, okay, there are indications. So it's if someone is unconscious, if you see someone fainting, if someone is a drowning victim, someone has gotten burns maybe from electricity, but there's something peculiar about burns from electricity, which I'll explain later.
Okay.
So I'd try and call out to you, sir, can you hear me? And then there's no response. So I come down, try to feel for a pulse. There's none. Or maybe the person isn't breathing too well. So now I'd have to initiate CPR. So the aim is, I need to push you again. So find what we call the sternum, which is the bone in the middle of the rib cage. Then use my dominant hand. I'm left-handed, so it's what most people do is they try and put it over the sternum, but that's wrong. You're trying to restart the heart.
Okay.
So one hand just to the left, so dominant hand to the left, and then interlock it with the right, and then press down. So that would be about, I'd have to push down to about 5 cm. That's about this much.
Okay.
So down like this. And it has, I'm so sorry. So it has to come from my arms. So what you do is to just push all your weight down and bear down. So you'd have to do about 100 to 120 compressions per minute.
Okay.
So that's about 30.
Okay.
So that's 1, 2, 3, 4, 5. So most people do is they count in their heads.
Okay.
Then if there's a friend or anyone helping, by the time they reach 28, 27, they speak. So if there's an
where am I?
So yay, it has worked.
Yes, you worked.
All right.
So I'm up.
Yeah, up.
Okay, so that's it. And you
Yes,
count.
that's
You do how many of those movements?
So you do that. Well, before COVID, the teaching was 30 compressions to 2 rescue breaths. The rescue breath is what is traditionally known as mouth to mouth.
Okay.
But now with COVID and after doing more studies, it's been shown that the most important thing is restarting the heart.
Okay.
So you can just go on,
Okay.
again, 100 to 120 every minute.
Okay.
And then when you periodically check, when you feel a pulse, then you stop.
And then when the person is, you can see that the signs of life. The next thing is what?
The signs of life would be the pulse.
Okay.
So within that time, someone should have called an ambulance.
Okay.
So that at least the person can be safely transported.
All right.
Yes.
Are we done with the rug?
Yes.
So we can go back.
Yes,
All
we
right.
can.
So you're watching GTV Breakfast, and it's first 8 tips. I'm here with Dr. Joelle Amissah, and we've done some demonstrations on what to do. Because these are life and death things.
Yes,
You know, if you don't know how to do these things, you can lose somebody who could have been saved.
Yes.
Um,
And if you're overzealous with helping, like for example, there's someone on the ground, and one of the things you have to do is to make sure the cervical spine is intact. What happens a lot of time is someone has been involved in an accident and their limbs strewn all over. Someone thinks they are helping, they carry this person without realizing that there could be a problem with the neck, and that is what would render someone paraplegic. That's what would paralyze someone.
wow. In an attempt to help the person,
Yes.
you actually make it worse.
Yes. So you just try and see. If you're not sure, just wait for an EMT. Don't move anyone. The splinting that we did, it can be done without having to move the person excessively or trying to carry the person. You can just concentrate on whichever part of the body you can help, but just leave the head and neck alone.
Okay. Leave the head and neck alone, people. You may cause more injuries than are actually there. Now, years ago, my grandmother passed out after taking snuff, tobacco.
Okay.
And the first thing we did, we poured water on her. Was that wrong?
Yes, it was.
We could have drowned the old lady. Eh? What should you do when something like that happens?
So you just, again, find a safe space, find a safe environment. If there are any sharp objects or if there's anything around that could cause any harm, you just move it away. And then the principle of leg elevation again, because you said she passed out, so that's like a fainting. So you just elevate the legs.
Okay. Quick do's and don'ts about first aid boxes before we run out of here.
Okay, so you should check that all your items are always up to date, because for something like medication, disinfectants, they have expiry dates. So if, for example, you haven't used it in a long while, just make sure that everything is still up to date. Don't leave it out, especially if you have children about, because they may get into it and it may cause them more harm than good. If you take something out, then replace it so that if you need it again.
Then I see people keeping their first aid box on the dashboard in their car with the sun falling on it.
No. It should be in a cool and dry place.
Cool and dry place. Any last words on first aid that people may want to just hold on to? So
we've been getting a few severed limbs. So, for example, someone is at work and then they're using a grinder and it just chops their... Yes. So for those, even though we've done some education, I think one of the most common mistakes is people putting the finger directly on ice. And like we were saying earlier, if you do that, you're exposed to cold temperature and then the finger rather dies more quickly. So what you should do is find a clean plastic or rubber bag, put the finger in, and then, or the severed part in, and then put that on ice. Bring that to the hospital as quickly as possible.
Time is of the essence.
Yes.
How about other parts of the body that have been severed before? Ears? Ears severed sometimes? Yes. Well, I saw a story of a severed penis. Is it common?
It's not that common. Penile fracture is more common, but...
You've never come across any of those before?
I personally
Please don't come across any of those. Just thinking about it is just painful. Well, Dr. Joelle Amissah, I want to thank you very much. I've learned a lot. And I hope you've learned a lot too. So you want to be watching GTV Breakfast, okay? And 11